Thanks, Dr. Leah. A senior man writes, I've heard you talk about testosterone, and I would like to find out more because of some sexual issues I'm having. Any suggestions?
Low testosterone can reduce your ability to have satisfying sex. It can result in a lack of sex drive and erectile dysfunction. However, low testosterone symptoms don't always include the feeling of a low sex drive. Some men maintain sexual desire at relatively low testosterone levels, while others have low desire at normal testosterone levels. Nonetheless, if testosterone is severely lowered, almost all men will experience some decline in sex drive. But keep in mind that low testosterone is rarely solely responsible for erectile dysfunction. Erection problems can be caused by stress, anxiety, lack of sleep, even a poor diet. Oftentimes, erectile dysfunction is caused by heart disease, diabetes, as well as the medications that are used to treat them. Atherosclerosis, or the hardening of the arteries, is one of the main causes of erectile dysfunction, since these arteries also supply the penis with blood. Low testosterone frequently accompanies atherosclerosis, creating erectile dysfunction. Low testosterone is linked to metabolic syndrome, obesity, and diabetes. Low testosterone doesn't cause these conditions, but the correlation is significant. If you're thinking about testosterone therapy, you need to get your testosterone levels tested first. Testosterone treatment has not been shown to improve erections in men with normal testosterone levels. Low testosterone may affect the desire for sex, but it rarely causes erectile dysfunction. Testosterone replacement therapy also has many risks. It can cause the body to retain too much fluid, it can cause acne, enlarged prostate, enlarged breasts, and it can lower fertility and increase sleep symptoms. However, testosterone therapy can be helpful if you've seen other symptoms such as loss of body hair, a drop in muscle size, or loss of bone mass.